Welcome to Our Scars Speak. My name is Christina Miner. I am the host of this podcast. And before we begin, I'd like to give a disclaimer that we are not providing any type of medical advice or any advice to you as far as your treatment plan. We encourage you to stick with whomever you have, and we're not being held liable for anything that you hear tonight. Of course, you may hear something that you want to just take in and go back to your doctors, and you do what you want to with the information, but we are not being held liable. So without further ado tonight, I want to introduce Amy Hartl tonight. She is an awesome, powerful woman. I met her through Instagram. I think through Wildfire, actually, our other friend. So it's a magazine, by the way. But I think that's how I met you. I'm pretty sure that's how I met you. But
I think that's right.
Yeah. And then from there, the groups and everything. So she is a powerful businesswoman. She has a lot of things that she's doing, that she has her hands in. She's very knowledgeable of all the information she's going to provide tonight. But the main thing is definitely her story, which is just absolutely dynamic. And I'm so thankful you're here to share with us tonight. I was scared you weren't going to make it because you were, but I was like, yes, thank you. You said yes. I appreciate that so much.
Well, thank you. I appreciate the invitation. I'm honored to be here, and I'm really excited for our chat tonight.
Yeah, absolutely. So first and foremost, like I do with every other guest, please share with everyone, how do you describe yourself? Who is Amy?
Okay. You want this without the titles, right?
You do whatever you want to do. You can even throw some titles in there, but who are you?
Sure.
How do you describe yourself?
Well, for those of you who are brand new to meeting me, my name is Amy Hartl. I am your breast cancer self-care specialist. And actually, in my professional world, I am a practicing oncology massage and certified manual lymphatic drainage therapist. I also happen to be a BRCA1 positive breast cancer survivor, and I guess technically an ovarian cancer previvor, because I had very high risk of that too, and opted to have my ovaries and fallopian tubes removed to hopefully never have to deal with that particular diagnosis. But outside of breast cancer land, I'm 48 years old. I am a wife. I am a daughter, a sister. I love to travel. I grew up singing. I am a very curious person. I love to learn. And I've been self-employed for a dozen years. And honestly, sometimes I feel like business and my business is my hobby, because I find it so fun and fascinating to kind of create something from the ground up, and to do it in a way that gives back and serves others, as well as takes care of myself.
Wow. Well, you gave a very good description of you, which I know you're going to tell us everything, all things about the things that you do. And I love the fact that you love what you do, because a lot of times, as you know, that when we love what we do, even though if it's work, it's our passion. So it's like, it's hard to turn it off sometimes. We overwork probably a little bit too much. We have a hard time saying no for certain things. I definitely can relate. But yeah, so this is good because our heart is in it. It's not just something we're doing to get money or get attention. It's like, we really love what we do. So I know that your journey, obviously you have a gene mutation, which you are very outspoken about and you're an advocate for. But also, if you could just tell us, like, you can go as far back as you like. What was life like before cancer even came into picture, or was cancer always something that you heard? Just share with us, like, what was your life like before you received the diagnosis or was knowledgeable even about the mutation?
Yeah. Well, in my family, cancer goes back to my childhood. I really first became aware of cancer as a thing. I was probably around 6 years old when my maternal grandmother was diagnosed with breast cancer, and she had a single mastectomy and did not have to have radiation or chemotherapy at that point. So, I was little and I just wanted her to be okay, and I was glad she was. And honestly, just being a kid, like, I think I was more fascinated by her prosthetic breast, because there was, it was like weird, soft, and fun to play with, and that was kind of that. But then when I was 12, my mother was diagnosed with breast cancer. And she was only 38 at the time. My brother was 3 years old, and my sister was 6 months old. And so that was when I really became aware of cancer. Like when I really kind of realized what a scary thing this was, how disruptive it was. My mom was young. It was an aggressive diagnosis. And I was old enough not only to understand, but to also be a help to her with my brother and sister. She went through, this was now over 35 years ago. So she went through 10 rounds of chemotherapy. All of them were an adriamycin cocktail. So she had 10 rounds of the Red Devil, which any of us who've been through that, I think can, have a hard time even imagining. I had a hard time making it through four. And she had 7 weeks of overlapping radiation. And so that was a very impactful experience. That said, I think growing up, that really kind of solidified the idea that I was at high risk. And this was really just as the whole BRCA thing was coming to light, as gene mutations were really being identified, most notably at the time, BRCA1 and BRCA2. I actually never confirmed my BRCA genetic status until 2016, until I was 40. But I was always treated as high risk. So I had my first mammogram at 23. I started going for them annually at 30. I was getting transvaginal ultrasounds. Like there was all this monitoring. And so it was really never not a part of my life. That said, I tried to just also enjoy life. I mean, I don't think I worried about it when I was in my teens, and even in my 20s, it wasn't something that I actively was concerned about. I was involved in theater and music, and I was an English major, and I did stupid stuff that people do sometimes when they're younger. I smoked for a lot of years, which of course, looking back, I'm like, well, that wasn't smart. But, there was probably a little bit of me that was slightly rebellious against this cancer predisposition. Kind of just thinking like, I just want to be normal. I don't want to have to deal with this. But as I got older, as I started getting into, my late 20s and my 30s, and I made life decisions like getting married and then getting divorced and then changing careers, cancer was always a part of that for me. I do remember in college, like having a complete meltdown because my boyfriend and I at the time were talking about it, what does the future look like together? And me thinking, well, I can't get married and have kids because I'm going to get cancer young and I'll die and I'll leave them. And, and being told, well, if you're going to have children, you need to do it very young. And then you can, kind of have everything, because that supposedly helps reduce cancer risk. And so it was always this presence. I tried very hard though to live my life anyway, and to make decisions from my heart and not out of fear. And ultimately I was diagnosed, in 2017. So it was 1 year after confirming my genetic mutation. This was in 2017, 7 years ago now. And I had just started to explore the idea of a prophylactic mastectomy. But even then I didn't know, I wasn't on social media in the breast cancer community a whole lot. I didn't know a lot of other previvors. I knew that it was an option. My doctors had talked to me about it, but I wasn't at the point where I was really ready to jump on that. Whereas I feel like younger people who living with maybe a predisposition or a high risk status, there's a lot more community and opportunity to really learn about it and kind of embrace it and support for those who decide to take that most aggressive measure. So for me, when I was diagnosed, that was kind of the answer. The good news is I was part of a whole high risk program. So I was monitored closely. When I brought them a concern, they were very attentive to it. And that meant that we caught the tumor early. I had a stage 1 diagnosis. despite it being a small early stage tumor, it was rather aggressive. And so for me, the right option was a double mastectomy, and having my ovaries and fallopian tubes removed. And then ultimately, chemotherapy ended up being a I don't want to say necessary, but it was strongly recommended, because I had a hormone positive, I had an ER positive tumor. They did the Oncotype test on me, which just gave them more information about the specific genomics of my tumor, and it showed that chemotherapy would be very beneficial in reducing my risk of recurrence. So yeah, so 7 years later, and
Wow.
7 years later, two boobs removed, two new implants placed, 8 rounds of chemotherapy, and I'm doing all right.
Wow.
Surgical menopause, like I'm figuring it out, like we all
So,
are.
so with you, it started when you were young with your family members. So
Yeah,
I guess tonight you're kind of speaking not just about your story, but also like as a survivor, but also as a caregiver. I'm sure you probably had
yeah.
to help your mother at times. I don't know. I mean, you share with us. Did you have to help her when she was going through chemotherapy? Because I know a lot of times women are fatigued and not feeling
Yeah.
well.
Yeah. Yeah. I mean, I being an older sibling to my
Mhm.
brother and sister, I was 9 when my brother was born, 11 when my sister was born. So, being a little bit older, I was kind of like, they still, all these years later, kind of call me mom number two sometimes. And, one of the nice things is I was able to help with them. So more than even taking care of my mom, I think I helped out with the kids quite a bit. Like, she has a story, and I've written about this on my blog before, but she tells a story about remembering being really sick in bed with chemo, and me standing in her bedroom doorway. And I mean, I'm 12, and I've got a 6-month-old baby on one hip, and I've got my toddler brother by the hand in the other, asking, Mommy, are you going to feel okay? Can you get out of bed today? And I don't remember that so much. I don't remember it being super hard. I remember things like witnessing her reactions to things, her losing her hair, her trying on wigs and having to make that adjustment. Growing up, I remember being in high school, a few years later, and someone she had met in the community and become friends with had a recurrence and passed away. And that's when really kind of the larger impact of a cancer diagnosis really started to hit home, is that this doesn't really ever leave you. That we heal, we physically heal, and hopefully we also mentally and emotionally heal, but it doesn't ever really go away, not completely, not
Right,
for most of us.
right.
Yeah.
What could you
Yeah.
share, if you don't mind, for maybe a parent or even a child who's maybe a teenager who may listen to this? What could you share as like a tip or something that you remember as a child that other
Mm.
children should know, or like a parent may should know, based off your perspective? What
Yeah.
exactly?
Mm. I think that, it as a kid, it was hard to always know what to say or do or the right thing. Like, I remember one time I hurt my mom's feelings really badly, and I was just a kid and it wasn't anyone's fault. She had gone to get a new wig, and she had it styled and everything, and I didn't know that she was coming home with new hair. And when she walked in the door, I think I yelled out, like, "Oh my God," because I didn't even recognize her. Like, it just looked so dramatically different. And in that moment, of course, she was already struggling with how she felt and how she looked, and, this change. And then feeling kind of, I don't know exactly how it felt. I think it hurt her feelings, that like maybe it didn't look good. And I don't think it was that. I think it was just I wasn't expecting it. So I do think there's a level of communication that's probably really helpful for people, especially when you're dealing with children. There are some great resources out there about how to talk to kids about cancer, and how to help them understand. I think a lot of it isn't shielding kids from it. I think it's about just communicating it at a level that they can understand, or maybe helping prepare them that, like, this is what might happen, or, you know, from an adult standpoint, that helping children understand that mom or dad or grandma may not always act like themselves, or they may react in a different way because they're going through a hard time. So that's just kind of one scenario that I remember that sticks with me, you know, as kind of an impactful moment through that experience.
And I'm sure a lot of this, maybe at the time you didn't know, but that had to be traumatic, various aspects that you may not even remember anymore, because sometimes
Right.
trauma, we have a tendency, our brain has a tendency to kind of like, okay, nope, you're not going to remember that.
Right. Right. We
And
don't need to hold on to every
you don't need
detail
to
of that
hold, you don't
experience.
need to hold on to it. So we're just going to put it
Yeah.
back here in the subconscious.
Yeah.
But I thank you for sharing that, because there are, as you know already, a lot of people who are going through this with small children. And it's
Sure.
interesting what you said, because it's like, as we embrace, we also have to help our children embrace, which can be kind of difficult if you're not feeling well. But at the same time,
Yeah.
yeah, not taking everything that they say, especially when they're smaller, to heart, because they may not understand the whole
Yeah.
situation, and like an
Yeah.
adult would. But
Yeah.
yeah, so that's okay. So that part of your story, I don't think I ever heard in detail. So thank you
Yeah.
for sharing, because I'm sure someone that
Absolutely.
helped them a lot. Um,
Yeah.
you found out that you had a tumor. What exactly, how did you find out? Like, were you in, a lot of women say they found it in the shower, or laying down doing a breast exam. How was because you already knew, you've been, you knew about this years and years as far as the gene, and you
Yeah.
were thinking about doing prophylactic, but
Yeah.
how does all happen for you?
So mine's kind of a weird story. And, you do obviously, a lot of people find a lump or their tumor,
Mhm.
like either through imaging or routine mammogram, or they feel something. Sometimes though, you hear people where they're like, I just knew something was wrong.
Right.
Um, Mine's a little bit of that. So one thing I will say about growing up with this predisposition is I probably was a little bit more of a hypochondriac than some people. I knowing that this could always be the case. There were times when I didn't trust my body, and so if something was going on, I could get very, kind of, I could get a lot of anxiety around it. And I had a clean mammogram in December. They would alternate me. So I would have once a year, I would have both a mammogram and an MRI, a breast MRI, but they would be every 6 months. So basically every 6 months I was getting looked at in a different way. So I'd had in December, I'd had a clean mammogram. I actually made sure to do that because I was quitting my job, and so that I could go back into massage therapy full time. We moved states, and so that kind of interrupted my career a bit. And so I was getting ready to re-enter being self-employed again. So I was kind of getting all my ducks in a row before I did that, and I had a clean mammogram. But in, I don't know, maybe like February-ish, I got a little spot on my breast, like a little red spot. And it was like a little ring, and I, was trying not to freak out about it. I'd already I have a mole on my toe, my big toe that's been there forever. So was a little obsessive at that point about, like, was it toe cancer? My
Right.
dermatologist assured me, my
Yeah.
dermatologist assured me it was not. But, so again, I had like all these things, right? So I'm
Yeah.
like, all right, I'm good to go. Like, here I go back into my career. Everything's fine. All the little I's dotted, T's crossed, whatever. But I got this little spot on my breast, and so I started with my dermatologist, or no, sorry, I started with my GP,
Mhm.
and after looking it up and after showing it to her and talking to her, we both kind of agreed that it was probably ringworm, like a fungal infection. And I think I maybe got it from a family pet. And so I put the fungal cream on it, like, and it was getting better. And it sounds kind of gross that yes, I had a fungus on my boob. But it was getting better. It was starting to go away. But honestly, my anxiety wasn't. I was really like in my head about it. And um, sometimes I would like when I would do a self breast exam or be feeling around, I could sometimes feel cysts and things of that nature that would come and go. And my GP had asked about that. And I was like, yeah, I don't think there's anything I'm really concerned about. I don't think I really feel anything. But you know how when you're kind of focused on something, you start to get in your head about it. And then you're like, well, is something there? Did I feel that? Was that always there? And you start to spin. And so oh my gosh, by the beginning of April, my anxiety was actually so through the roof. It was turning into almost like an OCD thing. Like I was having to get out of the car and go back and check and make sure I'd locked the front door because my brain just didn't trust anything anymore. And I, even though the spot was getting better, I just really was freaked out. And so I called the breast clinic at the high risk clinic where I was monitored, and I basically was crying and I was like, and I don't feel anything, and I think everything's okay, and I know I was just there, but like basically I'm gonna lose my mind. I need
Right,
someone
right,
to
check.
someone else. I need someone else to tell me that everything's fine. So I went back in, they took me very seriously. I went back in, they did a mammogram, which was clean again. They did an ultrasound and they said, well, we see like one cyst that's very clearly a cyst. We see something else that's looks probably just a complex cyst. You're due for an MRI anyway. Why don't we just give you the peace of mind you're looking for? We're just going to get your MRI done and then we can roll everything out. But truly made me feel like everything was so much better. I had the MRI. And then they called and said, there's actually something on the MRI that we do see that's different than last time, and we're going to do a biopsy. And that had never happened before. And I kind of at that point just thought, okay, there is like, this is it. And so they did the biopsy, and yeah, I think I think I had the biopsy. I think I had the biopsy on like a Friday, and they called me on Monday afternoon and told me that it was indeed cancer.
Wow.
So
How old are
yeah,
you again?
I was 41.
You were 41. Okay. And you had been,
Yeah,
you were getting mammograms from the age of 24,
23. I had
23.
my first one at
Okay.
23. So it was like I did, which was a fun phone call, trying to schedule that one. The nurse was just kept going,
Young.
are you supposed to be doing that? Yeah, exactly. I'm like, yes, I'm very well aware how young I am. Thank you. I think I did 23, 20, 23, like 20. It was basically like every 3 years till 30.
Okay.
And then from 30 on, it was every year that I had a mammogram. So yeah, so I mean, really, it was most of my young adult life until I actually was diagnosed.
So, because I know other people are probably wondering, like I am,
Yeah.
the so-called ringworm, was that really a ringworm or was that part of
I
or
No, I think it really was a ringworm.
okay. Okay.
It really was a ringworm. That said, I, you know, I do believe in signs and the connection of the universe, and I don't always know how that translates for me from maybe a spiritual or religious perspective. However, I've had a lot of things that just seem a little too, whatever to call them, coincidence. And I've had a lot of God winks in my life, I guess. And so there is part of me that while I do believe that it was actually ringworm, maybe that ringworm happened so that I would have the opportunity to find that tumor super early, as early as possible, before it had potentially spread or, required radiation as well, or gone to the lymph nodes or whatever.
Right.
So, yeah.
Wow. So you got a double mastectomy, correct?
Mm-hmm.
And so when you had that done, because I know everybody's treatment plan is so different. Did you have chemo first or afterwards? How did how did your treatment plan go as far as your
Yeah.
steps?
So for me, I had my surgery first because it was a small tumor. They didn't believe there was any lymph node involvement. They did the double mastectomy. I had a 7.5 hour surgery. They did the double mastectomy. And I was lucky that they were able to put my implants in. They did what they call prepectoral, over the muscle, direct to implant surgery. So I fortunately did not have to go through the expander process. I had one surgery. In that same surgery, they took my ovaries and fallopian tubes out. But it was after the surgery when, they get the final pathologies
Right.
that told them, based on the tumor specifics, that chemotherapy would be in my best interest, because it was small, but it was a high grade tumor. It was a meanie. And so they, that it also, though, told them that chemo would reduce the chances of recurrence. And so for me, it was, being young. And that's what my doctor said. They were like, look, you're young, you have this genetic mutation, which means your body is not as equipped to fight breast cancer and ovarian cancer cells. So why don't we hit it with all we've got at this point? And I was willing to do that.
Okay. And so you had so it was a stage 1 and a grade 3, because you said it was aggressive. Okay.
Yeah.
Okay.
Yeah. That's exactly right. It was a stage 1, grade 3, ER positive, PR negative, HER2 negative
Oh,
tumor.
okay. So I was about to ask you what was the positives and the negatives.
Yeah.
Okay.
Yeah. So I was ER positive, PR negative, HER2 negative. And so they treated me as hormone positive. So I'm also on, even though, I went into surgical menopause by having my ovaries and fallopian tubes out, I have been on an aromatase inhibitor for 7 years.
Okay.
So
okay. Do you have to
3
stay
more to
on
go.
Yeah, I was about to ask you, you have
10
to
years.
stay on 10? Okay.
Yeah. 10
Yeah.
years. Yeah.
Wow. That is
Yeah.
so after that, like, what has life, because I know the profession that you're in and you've shared with everyone.
Yeah.
How did all that evolve? Like after the treatment and after all of that, how then did life go for you after? Or I never say after, I always say now, because to me it's like a lot of people, when you tell them after, they're like, oh, you're cancer free, you don't have to worry about it no more. And I'm like, not so much.
Yep. I struggle. It's funny. I struggle with using the word after breast cancer too, because I do think that even those of us who are lucky enough to be declared cancer free, or in remission, or however you want to, whatever terminology you want to use, I feel like there's after diagnosis, right? There's after treatment, but there's never really like after cancer, because to me that feels like it's over, and it just isn't. Yeah. So life is good. I'm fortunate I'm really lucky to say, it did change professionally. So the thing that most people don't realize about my story is that I was actually doing this work. I was actually working in oncology massage before my own diagnosis. So I did a lot of different things in my background. I was in government contracting for a while. I had done retail professionally, I'd done all the things, right? But it was in my probably like early mid 30s that I decided for a big career change, and I decided to go to massage therapy school. I wanted to be in a field of service. I wanted to do something that was like heart centered, that I really felt like was a calling. And when I realized, I've always been fortunate to have experience touch in a positive manner. I grew up in an affectionate family. Touch was safe. It was comforting. I was exposed to massage therapy and body work at a young age, in a healthy, positive way. And so when I went to massage therapy school, it just like it was it. Like, this is what I'm supposed to do. What I didn't expect to realize is that in that process, when I was going through school and we were learning about all the different ways that we could do this work and all the different types of people we could work with, I learned about oncology massage, and that it was possible to work not only safely with people going through a cancer experience or living with a cancer history, but to work with them specifically around their recovery, their symptom management, and just to help them feel better.
Wow.
And, at the time, I think what really hit me was, what if this had been an option for my mom? What if when she was so young and she had these 3 young kids and she was going through hell with treatment, what if there had been someone who she could have gone and they could have just given her some comforting touch, or helped her, ease some scar tissue, or reduce nausea, or improve sleep, just through some really gentle, caring touch. And I also couldn't help but think, that could be me one day. Like, what if I'm the one on the table at some point? And so I was really, really drawn to that idea of learning about oncology massage. And so I started, doing that work pretty much. I started looking into that while I was still learning everything about massage. And I began pursuing that specialty as soon as I graduated and became licensed. So, I worked with everybody. I did a lot of general relaxation and whatever, but the great thing about a field like massage and a lot of other healing modalities is there are specializations. There are these, niches and these modalities that you can learn and incorporate and blend and weave together. So when I was diagnosed, I had already been working with the cancer community for 5 years.
Wow.
And yeah. And so what's interesting, what I always find interesting, is that I thought I knew a lot about cancer, especially because I had grown up high risk and I was constantly being monitored. And then I worked with all these people who were going through it themselves, breast cancer and others. And I had a lot of knowledge and a lot of exposure. And I still learned with my own diagnosis that there's some things you just can't know until you actually know them. And so I had to spend a lot of time thinking about, with my own experience, as I was going through it and as I was recovering and starting to get back to the idea of working, full time again in my chosen profession. I really had to give a lot of thought to, did I want to stay in cancer land? Because it is hard to be confronted with other people's mortality once you've had to confront your own. It is hard to witness other people's experiences when you've been through your own. And it certainly can be hard to hold space for others when you're also trying to hold space for yourself at the same time. And ultimately, through a lot of soul searching and a little bit of trial and getting back into it, the answer for me became fully yes, like absolutely, I'm all in. And one of the things that really struck me and that's driven me the last few years, God, it's not even a few anymore, it's 7 years since my diagnosis, is that one of the benefits that I had going into my diagnosis and treatment, and especially into my recovery and survivorship, was they did have all of this knowledge and experience. I wasn't blindsided. So maybe that is the gift of pre-vivorship, much as there's not a gift at all. But I wasn't, most people who are diagnosed with cancer don't have any kind of family history or genetic predisposition, which means most people have that rug pulled out from under them.
Right.
They don't see it coming. That was not the case for me. And so because of that, I knew a lot about my body. I knew a lot about what I would go through. I knew a lot of ways to take care of my body. And I had actually decided to pursue manual lymphatic drainage certification because I wanted to support my oncology massage practice. And I received my certification. I went and did the training class and received that certification 3 weeks before my own diagnosis. So coming into my own recovery and survivorship, I was able to do things like self-massage. I was able to do my own lymphatic drainage, which is both beneficial from a healing standpoint, as well as proper scar tissue formation, and to reduce the chances of having a lymphedema issue. And for me, what I realized is that was really empowering. I think what I probably knew intellectually, but could not understand internally until I went through it, is how much cancer takes from us that is intangible, that is invisible. It's not just breasts and hair or whatever other, for anyone who's not in the breast cancer space maybe, but it's the agency, it's the loss of control, it's the feeling of having choices taken from us. It may sound silly to some, but we had a big trip planned that summer, and we love to travel. My husband and I don't have children, we don't have pets. We love to explore the world, and that is what we spend a lot of our time and energy and money doing together. And we had to cancel a trip because, I was going to go through all this stuff. And so for me, a big part of what was important was being able to get back to that. And, I wanted to be able to get back on a plane and feel safe doing it, or go have adventures somewhere far away and not be afraid. And so having all of this knowledge and these skills really helped me feel like I was in partnership with my body instead of being at odds with it. And it also helped me feel like I got to be a part of my own care team.
Right.
And I wasn't solely dependent. I mean, trust me, I am an integrative oncology professional. I'm a big advocate of professionals, like you were saying. You always check with your doctor, your own medical team, right, prior to doing anything else. But one of the challenges so often is that in recovery, we end up with this like passive recovery situation, or this reactive care, especially when it comes to things like lymphedema risk and such. And what I experienced was the ability to go from passive recovery to active healing, the ability to be, feel like I was part of my own care team, not just solely dependent on others. And that was empowering to me in such an important way. And I think it was really that led me to decide that I was going all in on cancer, and specifically eventually breast cancer. So since going through all this, basically like since 2018, I slowly niched my practice down. So for the past about 2.5 years, I have only been working with breast cancer clients almost exclusively. And a few years ago, I started a second business called As We Are Now, that is focused on more of the proactive self-care, what I call self-care education and resources. So taking that knowledge and the way that I work with people when they come to me, and helping to put it into your hands. Because I do think that, even in small, tangible ways, one, I know that my clients the ones who engage in practical, relevant self-care activities kind of in their day-to-day lives on an ongoing basis, tend to have better results, because a little bit more frequently is going to yield a better result than someone like just going to see a professional once a month. But they also feel better. My favorite clients are the ones who come to me and, they can't walk out the door without crying, and they feel lost, and they start out and they've got pain and they've got discomfort and they're just overwhelmed. And, maybe over the course of a year, or sometimes it's sooner, sometimes it's a little bit longer, but like I have these clients who I have watched evolve from being so lost and so kind of at the mercy of what's happened to them, to now, like, I don't see them anymore, but for the best reasons, because they're out living their lives and they've learned how to, they've gone through that recovery process, and now they're out there, and when I do touch base with them, they're telling me about this great trip they just took, or this, activity that they've resumed, and how they're back to whatever. And they're doing it on their own because they've learned how to take care of themselves and trust their bodies again. And so for me, that has been the upside to having my own cancer experience, is that it transformed the work that I do from being something that I do for others into something that I help others do for themselves.
Yeah. And that's so significant. Everything that you said, because I can relate not being able to move my arms and being so grateful to go outside. And at one point I could only walk like 500 feet, but I had breast implant illness and stuff, but just being able to get that independency back, because it's gone like that. Like as soon as you get the diagnosis, a lot of people don't understand. As soon as we get that diagnosis, you want some type of control, but you never know what's going to happen from one test result to another. and you don't want to live in fear. You still want to live, but it's very
Yeah.
difficult and it's very hard. And sometimes some of us have more challenges than others when it comes to recovery. I had a physical therapist, I don't know if you know her, Dr. Walkie, on, she's the recovery room, but
Okay.
she mentioned something. It just reminded me of her when you were speaking, because she mentioned, in the hospital, they get cardiac patients up as soon as they have a heart attack or as soon as they have a stroke. But when it comes to cancer, especially also breast cancer, she was talking about, they don't move us like they want us to get out of bed, but they're not really having us to do much, not equivalent to some of the other situations
Yeah.
happen to patients. And so when you were speaking, that was the first thing that I thought about, how you're, definitely having people to go to their doctor, see when they can start moving, because we can't move right away, but they still
Mm-hmm.
could encourage us to get up a little bit more than what they do sometimes in the hospital with this particular diagnosis. And when I worked in the hospital, I seen it. And when she said it,
Mm-hmm.
I was like, you're right. Cause I used to work in a cardiac care unit. And I was like, they
Mm-hmm.
were up. If they could see and hear and move something, they were up,
They're
move.
up.
Um,
Yeah.
and for us, it's like move. So, you'll pass gas or something like that, but then it's like you're going to go home, but it's not as much as what you're saying, as far as like really, unless we go to rehab or see
Yeah.
individuals like yourself. So what you're doing is, I'm sure, very rewarding for you, but also so rewarding for your clients, because
Yeah.
that's one thing, to have everything stripped so quick, it's difficult. And then
Mhm.
if you're in the cancer world, seeing people go through even some other situations that, that are
Yeah.
sometimes, they transition, they don't make it, and
Yeah.
that's difficult. And all that together, I think you're helping people from all aspects, because with your self-care, they're not only learning how to self-care through their grief, through the maybe loss of breast or different things that they have to adapt to, but also maybe a friend. So your work
Mhm.
is very, very important.
Yeah. Thank you.
Yeah.
Yeah, I have worked with people at every stage of this experience at this point. I've been doing this work for 12 years. And I have worked with people from um, diagnosis, through surgery. I've had people on my table when they still have their drains in post-surgically. I definitely try to get people in post-surgically within the first like maybe 2 to 3 weeks
Right.
for very gentle lymph drainage to balance fluid and help with post-surgical recovery. I have worked with people many years out who are still dealing with complex scarring or chronic lymphedema. And I've worked with people living with metastatic disease, and sometimes that is worked with people in active chemo. Like there's the beautiful thing about something like oncology massage, and I do want to emphasize that this is a specialized
Right.
study of massage, and that it's really ideal even if you are years out from your experience, and even if you are healthy and active and have no real perceived side effects. It's still in your best interest, if you're going to go get that, any type of body work, that you work with someone who has been trained to understand cancer and cancer treatments and the lasting impacts. But what's great about this is when you do work with someone who has that knowledge and that training, there is really no phase of the experience where you can't work with someone.
Mhm.
I have even worked with people the day before they passed away, and been a part of their transition so that they could just have that comfort touch. And it's lovely and it's healing. And I think for me, it's really about the humanity and the connection. I also love the fact that for me, one of the things that I find challenging within the breast cancer community at times, or cancer in general, but especially with breast cancer, is um, the perceived idea, of what a cancer experience is versus what it really is, and the fact that you can have 100 people with the exact same diagnosis and the exact same treatment protocol, and you're still going to have 100 unique
Right.
cancer experiences, right? Because we're all different, we're all unique. And I think that what I have found through this work as well is that it's it's a way to allow people to be seen and heard for their experience, And I think that's what most of us really want at all in life, is just to be seen and heard for who we are, and to be accepted for that. And without putting something else or this idea of a cancer experience on us. And, being able just to hold space. Sometimes it is just focusing on the body. Sometimes it's the physical stuff that leads to the mental and emotional healing. I remember early on in my career, one of the things I found so impactful was um, I'd have someone come to me because they had scar tissue that was uncomfortable,
Mhm.
and they wanted, so we were doing some work around that. But then I would find out that it had been 2 years since their reconstructive surgery. They didn't feel attached to their breasts. They didn't feel comfortable in their skin. They wouldn't take their shirt off or look, with their partner, or look in the mirror. And because they let me in to do this work, this physical work, to focus on physical discomfort, as the barriers came down and as the discomfort eased, they became more comfortable in their body, and they started taking next steps to share their body, to be more okay with looking in the mirror, to leaving the lights on, to even touching themselves when they had been really opposed to that or uncomfortable with that. And so that's where I've also come to see how sometimes you start with the physical activity
Mhm.
that leads to the mental and emotional healing as well.
I believe that 100%, 100%. Just from, and I mean, oh, I can't even imagine like what you're experiencing with your clients, because I know for myself, and as yourself, like, what it feels like to look at your scars, what your body went through.
Mhm.
And like you stated, everybody's different. However, we all had that experience, and to touch
Mhm.
your chest, whether you have implants or you're flat, and to really be one with yourself and this
Mhm.
new body that you have now, and to get to know yourself again, is beautiful. And given that you are impacting lives in such a manner of them discovering themselves again, is very essential to healing.
Yeah.
Very essential.
Yeah. I feel really lucky, because I will say, you know, I have come to realize and embrace the fact that if there's something that sets me apart in the work that I do, it's not necessarily maybe my skills. I think I'm a good practitioner and a good therapist, but I think my superpowers are holding space for others. And especially in this community, because I know what my clients have been through. I can talk to, they can look at me and know that they are not saying anything that I don't get.
Right.
I may not know their exact unique perspective,
Mhm.
but I get it. And for myself and my clients, it makes it a very, very special relationship. And it's an honor for me, for everyone who walks through my door, and now for those who are that I'm connecting with out in the world through a lot of these digital and virtual offers that I've started.
That's so amazing. So, are there any tips you want people to know, or anything you want them to know about their lymphatic system, or anything you want to share regarding that? Because I know you're into what you do.
I am. I
So
am.
I
I
was
know.
like, I know she's gonna want to leave at least a couple of tips or something.
Too. Yeah. Well, so I think what I want people to know is that if if there's one thing to know about lymphedema risk, is that you don't have to live in fear, but you do need to understand it. And that is because almost every person who goes through a breast cancer diagnosis and treatment has some level of risk of developing lymphedema. So if you're watching this and you do not know, you've never heard this term lymphedema before, the shortest answer explanation of it is that it is a condition that can occur when the lymphatic system is damaged, and that typically, with cancer, that typically happens through lymph node biopsy, lymph node removal, and radiation therapy, although there can be other things that impact it as well. And when the lymphatic system is damaged, the fluid that moves through that system can start to stagnate and back up, and you can end up with swelling. And so, which, doesn't sound like the worst thing in the world, but I have met people who say that living with lymphedema is more frustrating than their actual breast cancer experience because it's a chronic condition. It can range from mild discomfort to severe life disruption. Um, and the thing is, we know a lot. The lymphatic studies of the lymphatic system and lymphedema research are still relatively young in the grand scheme of Western medicine, but we do know a lot. And we know enough that it is possible to take a proactive approach to lymphedema risk, to understand how, why this risk is created and what you can do to reduce your risk. Instead of just well, if it happens, what happens, or we'll deal with it if it happens, reactive approach, which unfortunately is still sometimes what the medical system follows. Oh, you don't have to worry about that, or you call us if you have a problem, right? And so my goal is to let people know that there is a lot more in your control when it comes to lymphedema risk than you probably have been told or taught. I believe we can trust people, we can trust women with their bodies to understand, to take those steps to get educated and decide if they want to take action. I don't want to live by a list of do's and don'ts. We've already talked about the fact that cancer takes a lot of control and agency and choice away, right? So I don't want to be told, well, don't do this and don't do that, or do this and you'll be fine. What I want to understand is how things work and why, so that I can decide what's right for me. And I want to live, I know personally, I want to live with less confusion, less fear, less overwhelm. I want to live more each day with more confidence and more ease. And that's exactly what I'm trying to put out into the world when it comes to lymphedema risk or even managing early lymphedema symptoms. So the first thing I would advise everyone to do if you've had a breast cancer diagnosis is at least ask your doctor for a referral to a certified lymphedema therapist. They're typically a PT or an OT. They should be covered by insurance if you have that, and that would include things like Medicare and Medicaid, I believe. And at the very least, they're going to set you up with a baseline consultation. They're going to give you a little bit of education. They're going to give you, take some measurements, and you kind of establish them as part of your team. The next thing then beyond that, I would say is, get educated, learn a little more, decide how much, how deep in the water do you want to go to kind of be that active participant in your body. It might just be, some people just want to know a little bit, and that's fine. And you can probably get that from your lymphedema therapist. If you want to do a real deep dive into having more information and more empowerment, I do have an ebook that I've just released called Breast Cancer's Best Kept Secret, your complete guide to breast cancer related lymphedema risk. And it is just that. It's a chapter by chapter, weekly chapter experience on how to understand the lymphatic system, what lymphedema is, why you don't want it, how to understand various risk factors. So like how your treatment may help you identify your risk factors. And then from there, common triggers, what is it that could create a lymphedema risk, and how do you then be able to go through your day to day using critical thinking skills, making informed decisions, so that you can decide what you're comfortable, doing or not doing. And then of course, tips on how to, self-care activities, professional care, all of that.
That is so good. Yeah, because there's a lot of myths out there. There's a lot of myths.
There are.
There's, which I'm sure you've heard some of them. There's some that's myths, some that's not myths. Some people still borderline, needles, blood pressure flying. I'm sure you've heard them all.
Yeah.
So yeah.
Oh, and actually, speaking of, I have a free quiz on my website. So my website's amyhartl.com, if you don't mind me plugging that.
Oh, not at all.
At the top of my website, there's a little bar, and it says like, how much do you really know about lymphedema risk? And you can take that. It's like a little 10-question quiz, and it'll give you the answer right there. And if you decide to have the results sent to your email, it'll give you kind of more personalized information and some other things to read and follow on. So that's my biggest thing is, and there's a lot of other ways to get involved with self-care, from the mind-body connection and from scars and things like that. But the thing that I really want to advocate for at this point anyway in my career, and what I see in the breast cancer community, the need is, let's start proactively empowering people to understand and manage lymphedema risk.
No, it's very important. And that's why not only do I have the physical therapist up here, but I had you up here because y'all are really saying the same thing. She hasn't been on in a while, but you're saying the same thing, which is really, really good. But at the same time, what I love about you, you have the self-care aspect of it. And what I loved about the information that you all have conveyed is like just the fact, and I'm sure you know, like they may say, oh yeah, you need to go to physical therapy. They may give you a physical therapist or something, but the point is it's not stressed. Sometimes it's not even offered. I've talked to a lot of people who didn't even know they could have gone to a physical therapist or a lymphatic, getting lymphatic massages. Some people did not, and they definitely don't know, like you were talking about, if it's been 10, 20 years, it doesn't matter. You still can go back.
It's a lifetime risk. And that, yes, it's a lymphedema is a lifetime risk, but so is your opportunity to manage that risk, that it doesn't matter if you're a few years out. Like, you can get educated at any time. You can seek care at any time. You can seek proactive care or start your own proactive self-care at any time.
Yep. So I love it. I'm going to purchase your book. I will do that tonight.
Thank you. Well, I would be honored to have you read it and tell me what you think. I'm very excited about it. It's been a labor of love that's taken me a while to get here and figure out, but that's been part of this whole experience too, is figuring out what is it I want to put out into the world. I mean, I will say that, I love my hands-on clients, but these two hands can only do so much.
Right.
And there's just so many of us in this community out there who deserve information and care and empowerment. And so I'm just happy to be one more piece of a big puzzle.
Absolutely. Because there's enough space for everyone. And that's the thing I hope everybody will understand. There's enough space for everybody. We don't have to tussle over space because we all have our own. And that's what I love about our entrepreneurial group, because it's like, it's just, we have space for all of us who are entrepreneurs that have gone through breast cancer. And we're not trying to say, no, this is mine. No, it's just, let's share. And
well, I learned one other thing I learned along the way, and in all kinds of aspects of life, but there's no one solution to any problem, right? Like, there's no one program that's going to solve all of our problems. And that doesn't matter if it's, if it's related to cancer or a job or anything else. Like, there's no one life coach that's going to have all of our answers. There's no one therapist. There's no one physical therapist. It's really about building, what I like to look at is building a self-care toolbox when it comes to my work. I don't do everything. I don't deal with certain things like weight management or weight loss. That's not in my wheelhouse. I can make some good referrals, but that's what, and I think that's where, again, where our responsibility and our personal action comes into play, is starting to be the one who says, well, I'm gonna, take this from this person and add that into my bucket, and this over here, I really got a lot out of that. And, the beautiful thing is, the more of us doing this in the community, the more of us who are having podcasts and doing great interviews and, sharing our skills or whatever, starting businesses, starting foundations, nonprofits, writing books, the more of us that are doing that, the more opportunities there are for everyone else to find what suits them. Because sometimes it's a practical skill, sometimes it's an actual piece of information, other times it's just a perspective or a vibe or a connection. Sometimes it's hearing it by the third person, the third way, when it goes, oh, that, I get it, that works for me, and so I love seeing, sadly, this is not a diagnosis that's going away anytime soon. We know that there's millions of people living in survivorship. There will continue to be tens of thousands, hundreds of thousands of people diagnosed every year for the foreseeable future. And that just means that we need all of the resources out there to be able to take care of each other and take care of ourselves.
That's right.
Yeah.
Well, this has been great. I definitely want you to share again where people can find you.
Sure.
You did share about your
Yep.
website, and I'm sure everything else
Yeah.
is up there, but if you want to share anything else, share that. And then I'll have you to share your song.
Oh, okay. Yeah. So the easiest place to find me is my website, and it's amyhartl.com. So it's amyhartl.com, just my name. I am on Instagram as well. It's as.we.r, wait, as.we.r.now. As we are now is the name of my online presence. And I do have a weekly newsletter that I send out. I call it the Sunday Self-Care Chronicles. I refer to everyone on my email list. I lovingly call them the As We Are Now Self-Care Sisterhood. So I would love to invite anyone listening to or watching to join my email list, and so I can pop into your inbox with a little bit of wisdom or inspiration or insight every Sunday. And yeah, usually I would say my website and my email I'm really consistent with. Instagram, I'm in and out. But if you get on my email list, you'll definitely hear from me. That I'm consistent with.
Okay, so You're Real. What was the name of your song? The name of the artist, and why did you choose the song? What significance is it to you?
This was a hard one because I have a lot of songs that are important to me, but I went with Long Live, Taylor's version by Taylor Swift. I am a Swiftie for sure. And yep, I am an adult Gen X Swiftie. And I chose that song because there's, if you listen to the lyrics, it's really all about being with your people and having that moment where everything is just right, like it just all comes together. And there's a line that's I've had the time of my life fighting dragons with you. And I know we often talk about cancer as a fight or a battle. I don't personally really love the battle language,
Right.
but this idea of fighting dragons with my friends, and and it's about being remembered and making an impact, and even if it's just for a moment. And I kind of think that's why we're here. We're here to touch other. I believe we're here to love. That's the biggest thing, is to put love out into the world, to love others, to try and connect, to try to be good people, and maybe leave the world a little bit better place than we found it. And so for me, there's something about that song that just feels very like hopeful, and it gives me feel good goosebumpies. So that's why I picked it.
Love it.
Yeah.
And what is your one word that you can leave with people? And okay, if it's 2 words, that's fine too. I mean, just what's your word that you can leave with people to encourage them? Maybe they're going through their own scars or wounds and they're healing, and something that can really encourage them, inspire them, maybe motivate them. Just a word. And why did you choose that word?
Okay. So I'm going to share my word
Okay.
because everything else just feels really trite or I don't know, cliched. So I'm going to share my word because I do have a word. I have the word rigged tattooed on my chest with 3 little birds, and it happens to sit over my port scar. I was looking for a word when I was going through everything because I wanted something to explain the feeling I had of connection and hope and being held and supported kind of by the universe and by my angels, or however, God, however you want to look at it. And there's a Rumi poem that says, live life as if everything is rigged in your favor. And what happened for me with my cancer experiences, as shitty as it was, as bad as it was, okay, as much as like it was really hard and the cancer was bad and chemo and all that, somehow everything still like went as well as it possibly could. And
Mm,
I had a lot of, I am not someone who's like, oh, cancer is a gift, not for me personally,
right.
but I've still had a lot of positive things happen since cancer and maybe even because of cancer. And so I try to hold on to that idea of things don't happen
Mhm.
to you, they happen for you if you let them. And so maybe think of life as being rigged in your favor. So if you hear the word rigged or hold on to the word rigged, you'll think of me. And but I hope it inspires hope and belief.
I like that. And I like your tattoo. That's so nice.
Thanks. Thanks. Well, again, funny quick story. When I got this, I have lots of tattoos, and
Uh-huh.
they were always just kind of like done on a whim. I had never made an appointment. This was the first one that I ever made like a formal appointment for, and I wanted it more on the like my arm. And when the artist and I were talking about it, it just didn't feel right. And she suggested here. And we realized that one of the little birds, and the three little birds for Bob Marley, every little thing's
Yeah.
going to be all right, we realized when she laid it down that one of the birds covered up my port scar. And as she started tattooing, I realized that it was the 1 year anniversary of my diagnosis. And I hadn't even planned it or thought of it until that moment. And so again, live life as if everything is rigged in your favor. So yeah,
Wow. I like that.
yeah.
When I've known you for a little bit now, just from meeting you in the group and everything, but when I hear you talk like it was like the first time I met you, I was like, oh, it's something about her. I really like um but you have this free spirit, gentle spirit as well, I think, and very graceful with your tone. So I can see how your clients come to you and feel soothed and feel like they can relax and trust you because you do have that spirit where it's like, I could trust her. I can just sit here butt naked, let her do my arms or whatever, and my chest or whatever to get the lymphatic
Yes.
system moving, and then end up falling in love with myself as she shows me how to love me again. And so I see that grace in you, but I also, because I know you and I know your F it Fridays, I
Yeah.
know that you're kind of tenacious too.
A little bit.
Just a little bit, but you're
Okay.
passionate. That's because you have a passion for what you have a passion for. And that comes out. Some people may, oh, that person's aggressive. No, it's not that a person's aggressive. It's the fact that you're passionate. And passion can appear to look very, very tenacious. And you're
Yeah.
very passionate about what you love and what you want people to be cared for. And you're
Yeah.
not afraid to speak your truth and even the truths of others who are afraid to speak or those who've passed on. So I
Yeah.
thank you for that. And I'm sure I'll be bumping into you again. But
Absolutely.
with that, also continue to listen to those, I call them God moments. You can call them universe moments, whatever you like to call them.
Yeah.
Keep on listening to them because obviously that's one of the reasons why you're still sitting here with us today. So
Absolutely.
thank
Yeah.
you for your obedience to those moments and for speaking up when so many or maybe you're just afraid to. So,
Yeah.
yeah.
Well, thank you.
You're welcome. You're welcome. Well, everyone, this is another episode of Our Scars Speak. And remember, we cannot tell you when to share your story, but if you feel like you need to, please do so because our mental and our physical scars can speak to those who have wounds that need to be healed. So, with that being said, we will see you next week and talk to you later. Bye. And we love you.